Hey everyone, I'm Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about staffing for your new practice, especially during startup, and what kind of things to consider before making your official hires. I've done a little bit of research, and what I have found consistently is medical practices have an overhead of about 60% of your overall income going to expenses. So that means your overheads go to supplies, vendors that support any kind of service to you, shred, waste management, that kind of thing, your utilities, your lease or your mortgage, and your payroll. Also, what I found is that medical payroll can be anywhere from 15 to 30% of the overall overhead. That means that you could be paying 50% of your overhead going to staff wages. That's not necessarily a bad thing because it depends on your specialty and what kind of staff you need to hire, but we're going to discuss that a little bit further moving forward. I want you to be able to decide what is best for your practice, given your situation, what state you practice, the laws and regulations on staff certifications and licensures, and also to keep these three key points in mind. They are efficiency, patient safety, which I feel is probably the biggest one, and the third one would be your overall budget. Hopefully, before you've gotten to this point of needing to hire staff, you have created a business plan, you've put together an opening startup budget, and then you also have a pro forma which forecasts a little bit further and it puts more detail into a long-term budget for you. Using your budget and pro forma, you should have a pretty good of ideas about how much you're going to be spending in staff salaries and wages, benefits included in that, and then also how you're willing to give a little bit or take a little bit from there and give yourself some cushion. The first thing I would do if I were you is write down which positions you definitely want to hire for in your practice. And you can start with your manager, and hopefully I always encourage to hire your manager early on if you can afford it and put it in your budget to afford, because they're going to be able to help you with all of these moving parts that go into opening your own practice. There are so many things that need to be done before you open behind the scenes that hiring an office manager or even a consultant to help with this position until you hire a manager at least 3 months before you plan to open your doors is super important in order for you to stay on time to open your doors and make sure you think of everything and complete everything. Then you will want to think about how many front office staff you're going to have, back office staff, a bookkeeper, any other providers you're going to be hiring, and what kind of providers that means, and so on. Now, there's some positions you just can't skimp on. You're always going to have someone there. So then you need to think about what kind of skills and qualifications you would like them to have when you hire them. Not only will this help you in writing their job descriptions, which you have to have by law, but also when you write their job postings to try to recruit appropriate people to pick from when hiring for your office. I know this seems really overwhelming, especially if you've never done any kind of HR before or tried to staff an office, but that is where a consultant or a manager can also come in and help you with this. So your front office staff. Depending on how many hours you're going to be open and how many days, you might need more than one. Overtime can hurt overhead. Paying overtime can kill a budget. That is why there are so many places that are so strict about staff going into overtime if they are an hourly paid employee. Now, you might think that an extra $40 per employee a month isn't that big of a deal, but when you're just a startup and you're trying to get patients and get your final contracting and credentialing with some payers and having to negotiate and pay for a big load of supplies and equipment to open your doors, it can make a big difference. And hopefully you have anticipated this in your budget, but let me tell you, as good as you can be at putting together a good startup budget and a very robust startup budget and a pro forma, things always happen and you're going to end up having to spend extra money somewhere. It's just the reality of it. And this is where watching your staff hours can really benefit you. So, front office staff. How many do you need based on the hours you're going to be working and how many days you're going to be open? Now, depending on your state, overtime can be calculated after 8 hours in a work day or after 40 hours of a work week. In California, they get paid daily if they work over 8 hours, where in Oregon and Washington, overtime doesn't kick in until after 40 hours in a pay week. So you definitely want to look into that. And a lot of places have a resource, like ours in Oregon is called the Bureau of Labor and Industry, or Oregon BOLI, BOLI, and they have a free resource where you can send emails if you have questions about any kind of thing related to labor and industries for your staff, and they will answer for you free of charge. Same for employees. If they ever have a question about how they're being treated or work hours or work conditions, they can reach out to them as well. So if you're not sure, definitely look for your free resources in that regard. So your front desk staff obviously will be able to answer phones and schedule patients and be face-to-face with patients, but it needs to go a little bit further than that, in my opinion, in a private practice. In a private practice, you want front office staff that have multiple abilities to multitask, but understand different parts of the practice as well. I always encourage small private practices to hire front desk staff that not only have a lot of experience so that you can feel comfortable with them being able to take the reins and troubleshoot things and come to you and make suggestions on how workflows can be changed or improved, but I always like to have a front office staff that have some kind of background in patient balance and accounts and or billing. So you might hire someone who can do the front office stuff, no problem, but they also are comfortable having financial conversations with patients, can read patient accounts and get in there and understand what the ERAs are and why they're responsible for a certain amount, and answer those questions for patients. The sooner you can answer those questions for patients, the better the patients feel, and you're not bombarding other staff with trying to make calls to patients to explain it to them if we can head it off in the beginning. Also, having front office staff that know how to scrub charts or code or send out claims. I mean, all of that is so helpful because you never know when someone's going to have to wear multiple hats, if somebody's out sick or had an unexpected reason for being out of the office, and somebody else can step in if they need to. Cross-training is huge, and your front and back office staff need to have a good relationship, but so does your front office and your billing team. Whether it's someone from an outside company doing your billing or through your EHR company or in-house, they need to be able to communicate really well because that is a huge power force when it comes to collecting money and making sure that things are getting put in the system correctly to send out clean claims. If you haven't yet, I have a video about training your front office staff, and I encourage you to watch it because maybe it will give you some ideas on how to interview your front office staff when you're hiring. The next thing is, do you need an MA or an RN for your back office, or do you need one of each? Obviously, this comes down to what treatments you offer patients, what's required when it comes to monitoring them after the treatments, and where their scope of practice it lies in their certifications and licensures. Medical assistants have to work under the doctor's license. That means that there needs to be laid out ways for the MA to be able to perform their duties under the doctor's guidance, and they have to stay within those. They cannot make independent decisions. They cannot do any kind of things that a nurse would do. Now, based on your state, you might have more strict requirements. Like in Washington, you have to hire medical assistants who are licensed and certified as a medical assistant. In Oregon or California or Idaho, your medical assistants don't even need to be certified, honestly. It's a preference that you can make, and you can decide if you only want to hire certified medical assistants or if you want to hire somebody and train them yourself on the job. You have to keep in mind what your state requires as far as compliance, and also if you're trying to apply for MACRA or MIPS, there's certain categories and percentages that have to be reported by certified and licensed staff members in order for you to qualify. So those are things you would want to look at, but can you get away with medical assistants versus RNs? I love RNs. I respect them. They do grunt work, and it's hard work most of the time, depending on where they work, but usually, and they cost a lot of money. Medical assistants are significantly cheaper, and you can monitor them just as well depending on what you're expecting them to do. Definitely look at your requirements for your state, your situation, and also where you can fall in with paying these people. You can always look up and see in your area what's the average wage for these positions to get an idea. So when you have that conversation with prospective employees and they're asking for a certain salary or hourly wage, you kind of have an idea if it falls into your area. Now, don't forget to include how much their benefits could cost. If you're offering medical, dental, vision benefits, retirement benefits, anything like that, that plays into the overall compensation for that staff member. That can significantly help you negotiate their salary or their hourly wage if you're offering a very robust and costly benefits package, and if the company is absorbing that amount or a significant amount of that. So RNs versus MAs, that's up to you, but definitely make sure you know what their scope of practice is, their limitations, and how much they cost. MAs or RNs that work the back office should always be cross-trained to help work the front desk. And this is for small practices. And that is something I would always bring up in an interview with potential staff members, and letting them know that because it's a small practice and we ask a lot of our staff, that we are going to ask them to cross-train in different positions, and that includes the front desk. I have ran into multiple medical assistants who tell me in their interview they're open to working the front desk, but then when we come down to trying to train them or we ask them to work the front desk, they either flat out refuse or they give me a lot of issues. So I decided I was doing an injustice during the interview process, not by just saying that we will be doing this, but explaining why we do it. I decided that it's important for me to explain to these people why we need them to do that. And also, if you create a really good team atmosphere and they realize that everybody's working really hard and wearing many hats and being asked to do other duties than just what they were hired for, usually you have a better buy-in. But the bigger you get and the busier you get, the harder it is for your back office staff a lot of times to want to work the front office. And that's why I think it's very important, especially in the beginning of opening your practice, to specifically and purposefully schedule your back office staff to have to cover, even during breaks or lunches, the front office, so that they're just always in that groove and it's not so scary to them when they get asked to do it. I really think they are not being defiant on purpose and not wanting to work the front desk. I think it's just very intimidating to them. And if they haven't done it for a really long time, they don't want to mess up or look like fools or feel foolish. And because honestly, I have had the best staff overall in all places I have worked. And I feel I have done a very good job at hiring for the most part. I would say 85% of the time. And the staff members that kick and buck me from wanting to work the front desk, it is not because they are not team players, and it's not because they flat out refuse and don't want to, it's because they're uncomfortable and not sure. So if you can start everyone off with learning the front office the same, and then regularly scheduling them to be up there even for 10 to 15 minutes a day, it's going to make a big difference. Now, when you want to hire other providers, some things that you should consider are mid-levels. Now, depending on your state, it could be different because nurse practitioners do not have to be supervised in some states, such as Oregon and Washington, but they do in the state of Georgia. Physician assistants always have to be supervised by a physician. So definitely know what the requirements and the statutes are in your state, but definitely consider hiring a mid-level before hiring another doctor because they are significantly cheaper as well. Now, this is a personal preference, and I totally understand if you don't feel comfortable having to supervise or you don't have the time to supervise, and those are things that definitely need to be considered. But I do need to put it out there that considering a mid-level to start off with to work side by side with you, other than another doctor, may help your pocketbook significantly. Like I said, cross-training is a must. Whatever provider you hire to work with you, I would encourage to make sure that they're willing to room patients if your staff gets behind or stuck in a room, that they're willing to draw blood if they need to, or perform treatments that the back office staff would normally be doing, because it's really important that your staff sees the support from the providers, the owner, the manager, anyone who can jump in and help. That is leadership. That is leading without authority, and it just helps create a really good camaraderie in your office and culture that I'm hoping you would want to create in your office and build off of. So cross-training is important. Set the foundation from the get-go in the interviews and then during training itself to open the doors, and continue to encourage everyone to be willing to wear other hats from time to time and work in positions that they might not feel super comfortable with. There's no reason why your front desk staff couldn't even be trained to do basic vitals so that they can help your back office staff with triaging or putting people in a room if it gets really busy. You need to have a plan of how you're going to hire additional staff if you get really busy, which I hope is something that you experience very soon after opening your doors. But have a plan for that so you're not stuck trying to figure it out when it happens, and let the staff know what the plan is. So let them know before you open your doors that this is how we're going to make it work for a while, but when we reach this point or this collection dollar amount or this many patients on the schedule, we are going to hire this additional role or this additional position. That way they know there is help in sight and that you've already anticipated and planned for that. It helps everyone not only to put it into play when it needs to be, but the staff knows that you have already thought about it and addressed it, and there is hope when it gets crazy and chaotic and they're exhausted, that there will be help eventually. So when to hire for the positions? Like I said in the beginning, hiring for a manager or consultant at least 3 months before you open your doors, I feel is very important. There are so many things that need to be done behind the scenes, and actually I'm going to be doing a video about electronic health record systems and what needs to be asked about them and what needs to be done before you open your doors. That is something that you can assign to that person, since you're going to be dragged and put into a lot of other things that you need to do specifically as an owner and a doctor. And so having someone who can support and do some of these other things is very important. I would say to start trying to hire at least a month before the doors open for your other positions. And it definitely needs to reflect on the climate of unemployment in your area, and also where you are geographically and how easy or difficult it is to find staff. I would say about a month before you open your doors, because that gives them 2 weeks to be able to put in their 2-week notice. Hopefully they will give the 2-week notice, and then it gives 2 weeks to be able to allow them to come in and help set up the office when it comes to the furniture, the supplies, and then all of the trainings that need to be done. If your area is difficult in finding positions, or the unemployment rate is really low, or it's just difficult, I would suggest starting at least 2 months in advance to give you ample amount of time, and letting them know that you are going to be expecting them to be able to start working for you at least 2 weeks before your expected opening doors start date. Wages and salary. I encourage you to make sure that you know the appropriate ranges of salary and hourly wages for your positions that you're hiring before you start the hiring process. You can go online and you can look in your area and make sure where people should be falling. So when you have that conversation with anyone you interview, you're ready to answer the questions and explain to them that perhaps because you are a smaller practice, an independent practice, it's very difficult to compete with the larger entities in the area. So you can only afford a lower range if this is your situation, which in my experience, a lot of private practices have trouble competing with the wages offered by bigger conglomerates such as Kaiser. But explaining to them that there are benefits of working in a small private practice versus a corporate entity, especially if they're new to the medical field and they don't understand that, then being able to explain that to them. Also to consider before having the salary or hourly wage conversation, depending on the position, it's either a salary or an hourly wage, that's why I keep going back and forth, is knowing what their overall compensation is going to be. And that requires you to know how much you are willing as a business to put towards any benefits that you're going to be offering to your staff. That means the medical, dental, vision, if you're going to offer any of those kind of benefits, your retirement benefits, anything like that that's going to go hand in hand on what you're going to be paying on the employee's behalf, because they might get paid less in their salary, but they might be paid more when it comes to the premiums for their insurance. And maybe that means more to them because they were paying a ton over at their last job, and you're willing to cover 75% of every employee's benefit when it comes to medical, dental, vision, and that for them is a huge bonus. So having that all prepared ahead of time and explaining that to your staff members or potential staff members could really benefit you. You also want to make sure that any wages or salaries that you're offering is staying within the range for their position and for the area. You don't want to put yourself in any liability or potential lawsuits or any kind of litigation when it comes to wage laws and discrimination and all the things that can come up. It's a very gray area. That's why it's very important to have a manager or a consultant who can help guide you on this, or utilizing the free resource that I've talked about called BOLI in our state of Oregon, Bureau of Labor and Industry. They have some free resources where you can communicate with people who work there asking certain questions just to make sure that you're not overstepping or missing something. The other thing is, if someone is kind of towards the top or capping out at their wage or salary for their position, which does happen whether people want to admit it or acknowledge it or not, certain positions do have a cap. It's just the reality. And if they do that and you still want to retain the employee and appreciate the employee, then there's ways to be creative to incentivize them in other ways, such as, biannual bonuses or putting extra money towards certain things. I mean, there's ways that you can get creative with these situations, and also giving cost of living wages when it's appropriate is always encouraged. You want to make sure that you are retaining staff as much as possible. So when you're making a hire, you definitely want to make sure it's someone that is going to stick around. Turnover is super, super expensive. I guess in hospitals, it could be anywhere from $52,000 to $80,000 it would cost the hospital for a nurse turnover. That's for one nurse that they have to replace. When it comes to the time it takes to find another nurse, train another nurse, staff another nurse, it's just insane. And Turnover for small practices is not only hard on the pocketbook, but it's also hard on your patients, it's hard on the other staff, and you just don't want to do it. So you want to make sure you're vetting these people, you're screening these people, you know what you want, and that they're able to fulfill what you are hoping they can do. And you want them to be committed, you want them to be loyal, and having those conversations during interviews is always good as well. I hope I covered everything. I'm sure I missed something or I haven't experienced something that's important. So if you want to share something with your colleagues, please put it in the comments below. I love to learn from that as well. Hit the thumbs up button if you think that it helped you today. If you think this will help someone else, one of your colleagues, please pass the word out about my channel and my videos, because I would love to grow my channel as much as possible. Subscribe to my channel if you haven't yet, and the bell icon, if you haven't hit that yet, it will notify you when I release new videos, which my goal is 2 a week. Thank you so much. I hope that this was helpful content. Let me know if there's any content you want me to make a video on in the comments, because that helps me as well. And I hope you guys are staying healthy and safe. Have a wonderful day.